Welcome, everybody, to the third episode of our chat about aging in your community. We're so pleased that you're joining us and listening in to our conversation with our special guest, Lisa Gonsalves, who's the Acting Commissioner of Community and Health Services for York Region. This is a local program, but of course, many of the topics that we discuss have relevance across the country, and even, sharing some of the international issues and challenges related to being able to age well and be able to continue to be engaged and socially active and really to live your best life, no matter what your age is. Studies have shown, as we know, that people want to be able to stay in their own communities, to be able to participate where they have been involved at all stages of their life, and also to live in their own homes as long as possible. So this podcast is brought to you by CHATS, Community and Home Assistance to Seniors. And we really want to be able to talk about the things that are important to older adults, to seniors in the community, and also to the supports that are available to them. So with all of that, I'd like to introduce you to Lisa. Lisa is a good friend, and we've known each other for a number of years and have had the pleasure of being able to work together between our two organizations. But for the last 24 years, Lisa has served in various roles at York Region, including the Regional Clerk's Office, the Office of the Chairman and CEO, and as Director of the Strategies and Partnerships Branch in the Community and Health Services Department. Lisa also spearheaded the region's newcomer and senior strategies and the Inclusion Charter, which actually earned international recognition from the United Nations Institute for Training and Research. So congratulations on that.
Thank you.
Since 2012, Lisa has been a member as well of the United Way Greater Toronto Board, serving now as chair of the Community Impact Committee, vice chair, and now chair of the board. So Lisa, I will turn it over to you now and ask you just to describe a little bit about the region's role in providing support to seniors, and why seniors? I mean, this is a level of government that is involved in a lot of big issues, infrastructure, water, things like that. So why senior services, and where does that fit into the priorities for the region?
Great question, Christina. And I think one of the interesting things about the seniors programs and portfolio, regional government actually doesn't have a mandated role. So you often hear governments talking about what their mandates are. So, but regional government, by the very nature of the services we provide. So I oversee community and health services. So we run the gamut of, services for residents in terms of public health, housing, social services. We have paramedic and senior services. So I think there's a real opportunity and alignment within our paramedic and senior services area in particular. We do provide paramedic services, and the majority of our calls, 911 calls, are from seniors. So there's a huge impact of the seniors population on emergency services, but also in housing. We oversee community housing in York Region, and we're the service system manager for housing, and the majority of our tenants are seniors. And also we have a really big wait list. Half of those are seniors. We also run 2 long-term care homes. So we've got 2 homes. There are 29 in York Region. We oversee 2 municipal homes, and we also have a variety of adult day programs, and partner with CHATS and as in that space as well. And we have our psychogeriatric resource consultant program as well. And we also have our seniors dental program in public health. But all this to say that we have a range of programs that we either deliver that are targeted to seniors, but many of our programs are impacted by seniors. As I mentioned before, they're the biggest growing part of our population. They're more than children. We've got more seniors than children, and we're estimated to even double that by 2051. So the impact of seniors on our programs and services is quite great. So it was important for us to start to prepare. Although I think many people will say that many of us are sort of late to the game in preparing to support seniors, but our council definitely saw a need for us to do what we can within our respective program areas and influence to support seniors to age in place gracefully. You mentioned earlier that many seniors, they want to stay in their homes. In fact, 97% of seniors living in York Region are in their homes or in community. Only about 3% are in sort of more congregate care. So there is a real, wicked problem, an issue that we need to come together on as partners and as government to support seniors so that they can age in place gracefully. So that's one of the reasons we took some concerted action to have more of a defined role through our strategy.
Mm-hmm. And I recall that the strategy and the supporting documentation that went into the development of the plan made reference to the fact that seniors are not a homogeneous group. In other words, we tend to lump seniors together as one group of aging people who have complex medical care needs and are really unable to live independently. And yet the study that you did and the data, the evidence
Yes.
suggests that quite the opposite is true, that the number of people that need that level of support and care is not necessarily the majority.
That's right. And so in terms of the region's role, so we do a lot of data analysis, and I kind of want to put a plug in for that as well, because we do have a lot of data that will help inform program planning. And you're quite right, very diverse group residents in York Region. Many are not even born here in Canada. So we've got a rich, diverse group of seniors that live in York Region. Many are volunteering, working, and caregiving, right, for our children as well. So the needs of seniors and being adaptable and not lumping seniors into one sort of group. And because I think there's been a lot of I think misunderstandings around all seniors being frail. That's not the case. We see many more seniors are working longer, are in the workplace still as well. So I want to contribute. And I think there's also been a lot of discussions about seniors not being able to use technology, for example. But we saw through COVID, yes, there are some that preferred paper and phones, but we saw a huge shift in the use of technology for seniors, and many are very tech savvy, right? So I think there's opportunities to actually work with our seniors population so that they are, given the same tools and equipped with the same opportunities as people who may be younger and not being seen as all frail. But at the same time, we do know that there is an aging group. So those 75 and over, that group's going to triple, right, in the next several years. So we do know after a certain age as well, there's health challenges. And so what can we do to prepare? What can we do to prevent people from falling through the cracks? So those are some of but you're bang on, Christina, in terms of the diversity of seniors, and we need to look at seniors and engage seniors in co-creating programs and services for them, right? That's something, again, we're really trying to move that change in culture and mindset and the way we look at seniors in our program planning as well.
Mm-hmm. I had a discussion with Member of Parliament Tony Van Bynen as part of this podcast, and he was mentioning that he was having a discussion with a physician who suggested that it's not unreasonable to think that in the next couple of decades we'll see people living to 120 years of age.
Yes.
And it does present a lot of challenges in terms of how you do plan for that, because even if they are reasonably well, and we're hearing a lot more about the super agers who are elderly in terms of chronological age, but are still very active and doing things, but they will have different needs, and it's a very different kind of population. One of the challenges as well that we're hearing more about are the financial concerns. You know, for those who are retiring early and starting to use their pension funds to travel and live their lives as best they can. If you're going to live another 40 years,
Right.
your finances becomes a concern. And what are you seeing in terms of that portion of seniors who are
Hmm.
having financial challenges?
Right. So we are seeing a growing, when we look at the data, we're seeing a growing low income populations in the seniors group. Still not at the same level, though, as maybe younger cohorts, but we are seeing a rise in low income. And one of the things that we we know that people want to stay in their homes, right? We see a lot of seniors who are asset rich but cash poor, and I think some of the mindset about leaving inheritances or for their children, and that sort of intergenerational wealth, that assumption that and because people are living much longer, right? And I mean, I tell my parents the same thing: don't save things for us, right? You've given so much to us, to society, and you got to take care of yourself. And so there's, I think people need to plan, right? Part of that is that planning piece. We see a lot of in our system, and in yours too, Christina. We see a lot of people who are in crisis, and there were things that could have probably been done to avoid that or to prevent that. So some of the work that we need to do is to educate and to really talk about this. And we even heard from caregivers, like when we were doing our strategy, we heard from caregivers, same thing. They'd rather their loved ones and their parents be able to to use their money to take care of themselves. But there's this culture where we feel like, or many seniors feel like they need to leave something behind.
Hmm.
And so there's a dialogue to be had there, and a conversation. Again, like, and planning for your retirement, planning for what happens if somebody gets sick or you're unable to live in your home. We're seeing a little bit more work around retrofitting and renovations and programs, so that we can modify, like, home modification programs for seniors. I strongly, strongly advise, if anyone listening who wants to retrofit their home, to look into this. It will probably give that person, some relief, avoid any accidents and falls, right? If we've got grab bars, if we've got showers that can be, you can use a mobility device in, or whether we've converted part of the main floor, with a full washroom, for example. So there are a lot of things that I think people can do to prepare. But unfortunately, right? It's, we all think we're going to be like this forever, and we're not.
Hmm.
So that's
Yeah.
that's something that there's a change in mindset that has to happen. But on the financial piece, there are some programs that the federal government's introduced. It's funny, like, a lot of times people don't know these things exist. So I think that's, and I'm sure we'll talk about this, is that, being aware of what programs and services are available, but it is scattered, right? Like, it's not in one place. And so one of our actions in our strategy is to create some sort of a directory. I know there's a lot of different directories, but we're going to try and build a directory that actually connects people to the information online. Like, so that it might be a print directory, but it's going to take it all into one place. So
Hmm.
we're looking to work, with the Ontario Health teams and other partners in putting that together, as an example.
Yeah, that's great to hear. It's one of the comments I often hear from people who will come across chats, and they'll say, I really wish that I had known about chats or those services when mom or dad, were still alive and could have used those services. And so often the caregivers, the families don't find out about things. And even if they do, sometimes the eligibility criteria, those kinds of uh, challenges, or they can actually be barriers,
Yes. Yes.
and understanding what we think is relatively straightforward is not so much if it's completely new to you. What are some of the
Yes,
things that York Region is doing in terms of helping to navigate? You talked about, developing
the,
this
the
directory, but
directory. Yes, and the other thing is, so we were trying to partner. One of in our strategy, you'll see there's a whole section around improving coordination and planning for seniors, and we also have another section in our plan around connecting seniors and caregivers to the right services at the right time. So we are, and a lot of this is because we can't do it ourselves. We are working with our Ontario health teams, I should say that differently, around the whole system navigation initiative. And there are some work underway provincially to scale up some of the system navigation work. So we're at the table in terms of influencing, because we want to make sure that York Region seniors needs are considered. Sometimes when you go to these big tables, right, you're one voice in many. And so we're using our data, our influence, our advocacy, we've got a seniors cluster table, which many of our senior serving organizations are a part of. And so we're using those opportunities to help build that system navigation tool, and contributing, whether it's our expertise, knowledge, and technology to the discussions. But as I said before, the other thing we're doing is we have our call center Access York, which is 1-877-464-9675.
thank
And
you.
we are going to be using the information around senior services. Like, they're going to be having more of a dedicated resource pool in Access York. So if someone calls Access York who is a senior, they'll have more information about referral to what programs. It's not something that's in our mandate, like I said before, like it usually, but because we get calls from seniors all the time, looking for support. So we're trying to beef up the resources that our call takers have in order to do that. The other thing we're doing is around our community paramedicine program.
Mhm.
So that's another really unique, innovative scope of change for paramedics, where we're building a pool of paramedics that are now in community. So we have our 911 paramedics who are transporting to hospital, but we also we've been mining the data to see where we have frequent callers, and in particular seniors, and we're working with the province to develop programs that will help keep people in their homes longer. So our community paramedics now have a rich pool of information about where seniors who are needing help. And so we have worked on a program where paramedics are going into people's homes that are frequent callers, let's say, or that need a little bit of help. Don't need to go to the hospital, but just need some, like, a health assessment, blood pressure taken, and they're highly skilled, right? And we work with the primary care
Mhm.
sector as
Mhm.
well, and they do referrals. So they now too have a lot of information about what services and supports are in York Region, and are referring these individuals that may be in our programs to those supports. So there's a lot of system navigation work happening within our current programs and when we're out in community, but also we're hoping to pull together a resource tool that is York Region specific.
Mhm. Can you give us some example of what the top 5 calls to 911 are, and how
Yes,
community paramedicine would take on serving
right,
those clients versus the ones that would need
right.
to be transported to hospital?
Right. So sometimes we have calls, where there's loneliness, like there's, where that individual, that senior has, or can't get to the grocery store, or so they're calling 911. So there's that piece where there's a bit of they're missing some, basic need supports, right? So and they're calling 911. We also have, calls where there could be a fall, like there could be a fall, but and sometimes, yeah, of course, we're going to take someone to the hospital, but it could be something in their house. Like their house may be needing some retrofitting, or there may be something that they need, some fall prevention education that's required. So that individual may go to the hospital, but when they come home, we've flagged them because maybe there's been a couple of incidences where that's happened. There could be incidences where someone just needed to they didn't take their medication, right?
Mm.
So blood pressure checks. So so that things like that, so that we can some diagnostics that we can do to prevent, right, someone from going to the hospital because they missed a medication or they forgot to take something or they mixed up something, right? So the other thing we've done is you may have seen them, we had created a number of years ago under the senior strategy, an information card. It's a medical information kit. It's a magnetic, it's just a little card, but it's got a little pocket and you can put it on your fridge. And what it does is it allows, it requires you to fill it out. It's a piece of paper and it includes all your medication, right? So if there's a 911 call, our paramedics they look for that. They look for that on the fridge or somewhere else. And it actually helps them determine level of treatment on scene. And it sort of gets to the crux of the issue quickly if they know what medication someone is on. So I highly encourage folks to get a kit, and they're all over York Region. But again, another one of those things where people aren't really aware. So if we can get our frontline workers and our agencies to give that out, even, right? There are little things that we can do to help, right, mitigate.
So I can put in my request now for chats to get some of these stickers. Super. And of course, we do serve about 500 clients throughout York Region and South Simcoe with assisted living services, where personal support workers are available 24/7 for both scheduled and unscheduled visits. So we do medication reminders, making sure that people are eating well. Nutrition is a huge issue in terms of being able to live well. We know that one of the things that people start to do is neglect their nutrition, or they may have food security issues for financial concerns too. And, that can lead to all kinds of other challenges, including falls. If you haven't eaten properly, that affects your blood pressure. And I mean, we know these things, but for somebody who is a little more frail and perhaps has some cognitive challenges, that becomes a real difficulty. So, that assisted living support in people's homes really does go a long way to enable even those who have frailty or complex care needs just to continue to live as independently as possible. And that I wanted to talk a little bit about housing. Housing has become in a crisis in the province, and mostly affordable housing, or housing that's affordable, and certainly for seniors who are on fixed incomes and so forth. It is becoming something that is of a crisis proportion. And you mentioned that you do provide seniors housing. What are some of the challenges, and what's the region doing to address them?
So there's a lot of, we are a nonprofit or a community housing provider. So we do have our lower income type housing for a more affordable subsidized housing. The issue there is that our stock is limited in terms of we're not building as quick as we need to. The pace is not. But I am proud that we've recently opened up a seniors building in Markham, just at Canadian Highway 7. But it's filled by the time, as soon as there's a wait list, right? So people wait a long time on the wait list before they can get. But once they're in our setting, it's lovely, right? We've got modified units. But it's not enough, and it is subsidized, so it's more affordable. But when we look at the retirement sector on the other, so you've got we've got that housing, and then you swing over to, retirement, which is very expensive, and again, not necessarily meeting the needs of those who are living on a fixed income, right? So you really have to plan for that if you're going to live in a retirement setting. Beautiful, but not everybody can do that. So we've been doing a lot more advocacy, right, around senior friendly housing. So we have, written to the province, and we've written to the federal government. We've talked, we're doing a lot more advocacy, but when it comes to seniors housing and built form, we've been working and advocating with our local municipal partners, who also, again, they're in the space of approving, right, developments. And so there are some developers that are looking at, targeting some of their housing to constructing more senior friendly housing. But again, it's the issue of affordability that continues to that's where we get stuck. But there are new co-housing models out there, right? Which I don't think we haven't, they're in pockets across internationally across the country in Ontario. But I don't feel that's really been, it's an untapped market in York Region. And we've released some papers around co-housing, and where you come together, a group of seniors come together and lease a place together, or buy a place, and then chip in around for groceries and coordinate for care. So that, I think those are models that need to be made real, and more of those in places like York Region, where we don't necessarily have places for people to downsize into, right? And then the other thing I would say is, and I know you're quite familiar, is around the NORCs, and naturally occurring retirement communities. So we know, like from data, we know that there are pockets, right, of higher percentages of seniors living in those communities. So being more proactive, right, in terms of bringing supports into those communities is another another innovation. Which I think it's it's funny, it's common sense when you think about it, right? But to make it happen, it requires a lot of advocacy. It requires senior levels of government also to help build those types of retirement communities where they're naturally occurring. And the supports are embedded in those neighborhoods. So
Yeah.
those are but housing that's a tough one. Like, I mean, we're doing our best. We also have a seniors hub that we are, as part of the seniors housing building in Unionville. So we are creating a hub on the main floor. It's still, we're still figuring out the model, and but ideally we know that we want to bring supports into that hub, not just for the people in the building, but also for the
community,
surrounding community, right? So hoping that is something that gets scaled up. It doesn't have to be York Region. We're using an opportunity because we have a building, but there's, council has made a commitment to make this happen. It's not in our mandate. So funding and resources often becomes a challenge when you're trying to do this type of work. And the one other thing I should mention, Christina, is that we have also advocated very strongly to the province for there to be a lead organization role of a service manager for seniors. We have a role and why I say this, at the municipal level, we are service managers for children, and we're service managers for housing. So what that means is we have a little bit more planning authority. So we can plan and build a system, and we have mandate to do that, right? And so our funding is tied to our system plan. There is no system plan for seniors. There's a lot of strategies. There's, people age-friendly, communities are becoming age-friendly, which is great, but there isn't a coordinating body for seniors like we have for children.
Yes. Yeah. And considering, as you said, the aging population is the seniors population is the fastest group in terms of demographics, and yet it's still not recognized in this way.
That's right. So I would also, anyone that has, influence, right, with these, and we have given our council a lot of information and key messages. The chairman has written multitude of letters, myriad of letters to the province. I am a little hopeful that, like the deputy minister, for example, at the provincial level, so the deputy for the Ministry of Health is also the deputy for Ministry of Seniors and Accessibility. So they've sort of, they've got one deputy minister for both ministries, and frankly, those ministries have the biggest claim or stake for seniors. And so we've been pushing hard at the policy levels we've shared our strategy. We've talked about the
I'm
service
so
system
glad
manager
to hear.
role.
Oh, I am so glad to hear this.
Yes, but we can
Yeah,
do more. We can do
yeah,
more, right? So we can use some of our cluster tables. I know that to try and do some more advocacy together. We've got some really good MPPs in York Region. So maybe we can coordinate something, right? So
yeah,
I think there's some
yeah.
opportunity there.
We're almost out of time. We've still got a couple minutes, but I didn't want to end without acknowledging the role that York Region and your team played. You mentioned the cluster tables, working with the United Way of Greater Toronto, bringing all of the service groups together to have a real focused approach and strategy around providing support to seniors and other people in the community during the pandemic. Um, it was that kind of coalescing, I
Yes.
believe, that enabled us to set aside worrying about where's the funding going to come from and who's funding, and just let's address what needed to happen in the community and get it done. Can you talk a little bit about that and where you see it going for the future?
So that table was a godsend, really. I mean, and I think for the first time we had partners, but for the first time we were collectively, really trying to save the seniors who were, impacted
Yeah.
by the pandemic. And we sort of took off all of our mandates, that hats, and we came together. And as a result, I know there's been quite a few innovations that came out of that table. So we want to continue. So it's not going anywhere. So we want to continue that table. I think that through the new senior strategy, we've got a number of actions where we have the cluster table. We see them as a having a role in helping us implement and execute those actions, because a lot of the actions in our strategy, we can't do them by ourselves. We
Mhm.
need partners. So when I would say that we're going to be working with the cluster table on each of our actions in the strategy to really help leverage the expertise, skill sets, connections, networks to implement those actions. And so there's more to come. There's definitely more to come, but that is an integral part of our implementation plan, is having that cluster table next to us, lockstep,
Mhm.
hand in hand. So that's
Good to hear, because I
yes,
think that it took, unfortunately, a crisis and tragedy really to get us all to, just as you say, take off the respective hats, but focus on working together, and hopefully we'll be able to continue to do that. Lisa,
yes.
I want to thank you so much
Oh,
for taking the time to speak with us and to share all that the region of York is doing in terms of providing supports to seniors, and especially the priorities that were identified in the seniors plan that was approved by council. If you want to share just where people can go to access
yes.
the plan, that would be helpful.
Yes, so if we go to york.ca // plan for seniors.
Great. Well, I hope people do take the time to look at that plan and understand, just what the priorities are, and the areas that the region is going to be putting emphasis and resources invested into helping our seniors, those that truly do, but also encouraging healthy, active living for
Yes,
the rest of us. So
yes.
I do want to thank
And
you,
thank you.
and thank the region.
And
It's
thank you,
been
Christina. Thank you.
great
Chad's
talking
been a
to you.
great partner. Have a good one. Take care.
Okay, you too.
Okay, bye.
Bye.